Welcome to Sound Bites, hosted by registered dietitian nutritionist Melissa Joy Dobbins. Let's delve into the science, the psychology, and the strategies behind good food and nutrition.
Hello and welcome back to the Sound Bites podcast. Today's episode is about infant feeding and food allergies and the newly released Dietary Guidelines for Americans, plus an important call to action for dietitians and other healthcare professionals. My guest today is Sherry Coleman Collins. She's a registered dietitian nutritionist, food allergy expert, and consultant for the National Peanut Board. She's been on the show before a couple years ago. Welcome back to the show, Sherry.
Thanks so much, Melissa Joy. It's great to be with you.
Great to have you here. So I understand that you developed the Academy of Nutrition and Dietetics Certificate of Training in Food Allergies, along with a distinguished group of experts. And you also authored the Academy's practice paper on the role of the registered dietitian nutritionist in food allergy diagnosis and management. So tell us a little bit more about yourself, your background, and your expertise in food allergies. As I mentioned, you were on the show before, so if people are interested, you were on episode 68 talking about peanut allergy prevention and number 91, food allergies at school. But we're going to take another deep dive into food allergies and some of these exciting updates with the dietary guidelines. But before we do that, like I said, just share a little bit more about yourself with our audience.
Sure. Well, I'm thrilled to be back on the show. Thank you so much for having me. It is my pleasure to talk about this subject. I am passionate about food allergies and education around this topic because I think that nobody really has enough information. We could all use more information, especially as professionals. Mm-hmm. So I started my career as a registered dietitian 15 years ago in pediatrics. I worked in clinical pediatrics, and specifically I worked with patients who had inflammatory bowel disease, so those who had Crohn's and colitis. And in many of those cases, I was working with young people and children who had food allergies. So that was kind of my first introduction to food allergies. I didn't learn a lot about it in my degree program. Like most dietitians, it's broad, but it can't be deep in every area. So I knew a little bit about food allergies, but I didn't really know certainly anything like I know now. Mm-hmm. But I loved working with kids who had food allergies and other kinds of conditions where food and nutrition could really make a huge difference in managing their conditions and then improving their life moving forward. Mm-hmm. So that's kind of how I started and my first introduction to food allergies. And then I went into school nutrition. I worked in school nutrition for about 5 years. And on our team, we had an amazing team of dietitians, but I was the only one who really had experience doing special diets, clinical type diets for children. So I was given the role of food allergies and special dietary accommodations. In that position, I really learned a lot about sort of the outside the clinical realm, outside the home, managing food allergies. And it was amazing. And I learned so much and made so many good relationships and really feel like I have a good understanding of how food allergy management in the schools happens and can happen better and how schools and families can work together to manage this issue. So that was sort of my second role in food allergies. And then I went to work for the National Peanut Board. And with them, I have learned even more and made great connections all around the world with people working on food allergy treatments and diagnosis and prevention now. And I've done that for almost 10 years. I've been working with them. It's hard to believe.
Oh, that's excellent. And I learned so much from you in the other two episodes that we did together, so much about peanut allergy prevention and just the school environment, and having my kids going through. So my son is now in 7th grade and my daughter's in college, but having seen how things changed so much, because they're 8 years apart, it's been really interesting. So I can't wait to get the updates from you today, but I do want to make sure to mention that this episode is sponsored by the National Peanut Board. The Peanut Board helps America's 7,000 peanut farmers through research, marketing, and promotion efforts that help strengthen the overall peanut industry. So we thank them for their sponsorship and support of the podcast. So Sherry, we know the new Dietary Guidelines for Americans were released at the end of December. Can you give us an overview of the updates that apply to infants, toddlers, and pregnancy? I know this is a really exciting new development.
Yeah, I mean, it really is. I think, it's kind of surprising if you think about the fact that we've had the dietary guidelines every 5 years for so many years, and yet they've never addressed infant and toddler nutrition. So this is really exciting, I think. Just giving us a sort of a goal, an overview, a big picture view of how infants and toddlers should be eating, so that as parents and caregivers and people who just care about the nutritional, sort of well-being of infants and children, we have a guideline. Everybody's nutrition is specific and there are personalizations that should happen. But in general, we now have very good guidelines on how babies and toddlers should be eating. And, some of the exciting things that are included there, of course, are the recommendations for prevention of food allergies. A long time ago, decades ago, we didn't know that we could prevent food allergies. And, the American Academy of Pediatrics back in 2000 actually recommended avoiding common allergens in infancy because they thought that that was the most conservative approach to helping prevent food allergies. And they were seeing food allergies rise for, 10 years before that. And they made that recommendation in order to try to prevent this increase. But in 2008, they saw that they actually came back out and said there's not evidence to support the idea of withholding, but they didn't recommend that children eat these allergens at that point.
Mm-hmm.
So fast forward, here we are, 2021 to 2020, the dietary guidelines came out. Now we know that actually eating these foods in infancy can prevent food allergies. And so it's sort of a complete shift, right? In 20 years, we've seen a complete shift from what was recommended to what now we know. And I think what we can learn from that really is the power of evidence and research. We need evidence and research to help us make these recommendations. And now we have really good evidence that shows that this early intervention that's super simple, right? Just feeding babies peanut foods that are, in a safe form, and then keeping it in the diet can actually prevent food allergies from developing.
Yeah, I remember when I learned about peanut allergy prevention from you, it was the exact opposite of what we thought. It seemed counterintuitive. Mm-hmm. And it seems like this journey has gone from avoiding to kind of in this neutral zone to really more proactively introducing these potentially allergenic foods. So it is amazing that the dietary guidelines previously have never addressed that 0 to 2 age group and pregnancy. Do you know why? Is there an insight as to why? Was it just that there was a lack of research on those populations?
I think so. I think, we're still learning so much. And as I mentioned, it's still a very personalized kind of issue, And I think one thing is that, a lot of times people kind of think of pregnancy as they treat it like a medical condition. And of course we know that, pregnancy is not a medical condition. It's really just a natural part of the life of many women. Most women will go through pregnancy and have a child, right? So I think that we're moving away from the medicalization of some of these natural cycles in a woman's life, I think. Mm-hmm. And, now we know that there are some wonderful things that we need to know about pregnancy and how we can improve and support healthy pregnancies and then healthy births and healthy babies. And nutrition is an important part of that, right? It's just one part, but it's an important part.
Yes, and clearly the revised dietary guidelines have a clear focus on different life stages.
Yes.
So it's very fitting. So before we focus more specifically on infant feeding and the potentially allergenic foods, can you kind of give us, I know that there are a few takeaways for pregnancy and babies overall in general from the 2020-2025 dietary guidelines. Could you share some of that with us?
Yeah, absolutely. Well, I think, one of the important things is that babies should be eating a varied diet. We know that makes sense. We know that children should be eating a varied diet. So, of course, to start with, there's the full support of breastfeeding. Breast milk is a great start for infants. And if breast milk is not available or isn't a possibility for that child, then formula is a complete nutrition. And babies need to be fed in accordance with what works best for their family, and fed is best is, I'm a big supporter of that. I think breastfeeding is fantastic, but for some women, that's not the best choice. And for some babies, that's not a possibility. Mm-hmm. So obviously breast milk, formula for the first year, and then complementary foods, which sometimes people call weaning foods. And that can be a little confusing because it's not really meant necessarily to wean from formula or breast milk. It's really meant to complement breast milk and formula. And those complementary foods should start around 6 months. Now, some babies might be ready a little bit earlier, but most babies, virtually all babies, are going to be ready around 6 months. And complementary food should start then.
Yeah, because I hear sometimes like 4 to 6 months.
Yeah.
And I think that has to do with the developmental, like can the baby sit up and certain developmental signs as far as like swallowing and things like that, right?
Yes, absolutely. Safety first, right? We want to make sure the baby's ready, that they're developmentally ready. As you said, they can sit up on their own. A little bit of support is fine, but they need to basically be able to sit up on their own. They need to have good head control and be able to swallow. That tongue thrust, where a baby will, if you put something in a baby's mouth, they spit it out immediately with their tongue sticking out. That tells you a lot about a baby's readiness. If that's still sticking around, they're probably not really ready for solid foods just yet. Now, it's normal, even at 6 months, 7 months, for a baby to spit out food or to stick out their tongue or even to gag a little bit when they're trying something for the first time. If you think about they've never had anything but liquid nutrition, then all of a sudden you stick something in their mouth that has texture, that tastes funny, that's got fiber in it, that's maybe tangy, it's not sweet, or, that's confusing for a baby in the beginning. They're like, oh my God, what are you doing to me? But, when they're ready, they show some signs. They'll watch you eat. They'll start to chew, even with nothing in their mouth. They sort of make that mastication kind of thing with their mouth. They'll lean in like they want to take a bite off your spoon, They'll reach towards it. They'll stick things in their mouth, like they're eating. Those are all things that tell us that a baby's ready.
Okay.
There are some cases in which starting before 6 months actually can be perhaps more preventative for food allergies. And that's something that we need to keep in mind too.
Okay. Very interesting. So this is fun to just picture, babies learning to eat. You're making me giggle.
Yeah.
So what are some of the other just overall takeaways that you would want to share with us before we get into the food allergies?
Yeah, well, we know that pregnant women also, just as I said, toddlers, young babies when they're starting to eat need a diverse diet. Pregnant women do too. So sort of backing up, thinking about supporting the maternal diet. Women need to eat a diverse diet that includes fish. That's one of the things that's a big part of the recommendations because of omega-3 fatty acids. We want to make sure that women are eating enough of those foods that can help support brain development for a baby. Of course, we want to think low mercury, right? So fish that are lower on the food chain are probably going to be a little bit safer for pregnant women. Mm-hmm. Folic acid supplementation, that's something that's been around a long time, and it's reinforced in the Dietary Guidelines as well. And then also, in addition to a daily prenatal vitamin, there are some recommendations and some goals for meeting around iron, iodine, and vitamin D.
Great. Thank you.
Yeah.
And then I know that there's also a recommendation about there's some breastfeeding information and sugar consumption, but you have a wonderful sort of infographic that I'm going to share in my show notes at soundbitesrd.com. So let's start talking about the food allergies. So is the development of food allergies something that you're seeing parents are still really concerned about? And maybe let us know, how prevalent are they?
Sure. Yeah, absolutely. I think parents, one of the great things that I think is happening now is that people are more aware of food allergies. That's really a good thing. We want to be aware of this issue because it does take a village, to keep kids with food allergies safer and to help adults with food allergies navigate that. It's not something that they can 100% manage on their own. They need information and support, and they need help sometimes. So the more people know about food allergies, the safer people with food allergies are. Also, at the same time, because people are more aware, sometimes people get more afraid, right? They're concerned, and sometimes concerned when they really don't need to be concerned. So if you don't have a history of allergic disease in your family, and you don't have any, and your baby's not showing any signs of allergy, and they don't have severe eczema, which I can come back to, that's a baby that probably has very little risk for food allergies, and you should be able to feed them and feel confident and not afraid. Move forward and don't worry so much about the child having a food allergy. Follow the guidelines and get those foods in. But sometimes, because people know a lot about food allergies, or maybe they have a friend who has a child with food allergies, or they've seen somebody have a food allergy reaction, or they've read about it, they can be afraid of food allergies unnecessarily and delay introducing food allergens because they're afraid. Does that make sense?
Yes, absolutely. Let's just recap what the top food allergens are.
Yeah, so in the U.S., there are 8 recognized top allergens. So milk, eggs, peanuts, tree nuts, fish, shellfish, soy, and wheat are the top 8. And then sesame is probably the 9th most common food allergen. And there's actually legislation now underway to require labeling of sesame, just like those other 8 allergens that I mentioned. Those top 8 allergens are required to be on the label of any packaged food that has a label. They're required to be on the label very clearly, and there are some very specific language requirements for labeling those allergens.
Thank you. And I know one of the surprising things I learned in one of your previous episodes, we were talking about food allergies at school. And I think my son was, well, that was a few years ago. He was definitely still in grade school at the time. And he was required to bring a fresh fruit or vegetable snack. And it couldn't be, to my dismay, it couldn't be like a fruit cup or an applesauce cup or something. I was like, it would have come in handy at times. It's hard to be a mom sometimes. Yeah. And I had assumed, actually, another mom had said to me, oh, that's because of food allergies, because that way, if we know it's a fresh fruit or vegetable, we know that it's not, doesn't have eggs or peanuts or tree nuts or whatever. And you enlightened me, like, well, people have allergies to fruits or vegetables too. So is it really like if a food has any protein in it, like you could really be allergic to almost any food? It's just not that common.
Yeah, you really can. I mean, I have met people and know people and have read about food allergy reactions to all kinds of foods. And in fact, the FDA website says over 150 different foods have been known to cause a food allergy reaction. So any food can cause a reaction. Those top 8 or 9, they're probably responsible for more than 90% of the reactions that happen, though. So that's why people are so focused on those foods.
Okay.
Unfortunately, I think sometimes people, they focus so much on eliminating the risk that they miss the fact that you can't completely eliminate risk. It's better to be prepared for a reaction than it is to have this false sense of security that, oh, the food's not here, so we don't have to worry about it. Well, that's not necessarily true because we can't control every food that comes into every environment. So it's much better to be aware and be prepared. And then if there is a reaction, when, it's very likely that a reaction will happen at some point, people are ready for it. And then people with food allergies are actually safer.
Yeah, I know. And I really want to direct people to go back and listen to that episode about school food allergies. And I'll put the link in my show notes because that really was a huge aha for me, that this false sense of security and how just avoiding bringing certain foods into the classroom, it really was kind of counterproductive to the overall goal. Okay, so I know that you probably don't know the prevalence or the incidence of all of the top 8 allergens. I know you know peanuts. So let's talk about that because I want to give some perspective because, we hear these top 8 and like you said, people can sort of get afraid and fearful about how, I think at one point when we were still doing birthday parties, I think like 4 out of the 8 people that were coming to my son's birthday party, had the EpiPen dropped off. And I was like, that just seems like a lot. So give us the numbers and give us perspective on the prevalence of peanut allergies.
Sure. Well, I would say that, in very young children, milk and eggs are probably more common than peanut. They're probably much more common. So when we think about infant feeding and, we need to think about all of the potential allergens that could cause a reaction. And milk and egg are implemented in causing more reactions than peanut, but peanut's up there too. Peanut probably affects around 2% of children. And, around 20% of those will outgrow it. So, maybe 1 in 5 of the peanut allergic infants will then go on, or children will then go on to outgrow that. But it does stick around more often than some of the other allergens. So milk and egg allergies, while they're more common in very young children, they're also outgrown more often. So it really depends on the age of the person, right? So when we're thinking about infants as compared to when we're thinking about adults, it really changes throughout the life cycle. And there are a lot of reasons that probably happens. When we think about infant nutrition or feeding to prevent food allergies, though, it's really important to think about, let's just say you think about that 2% number, right? 2% is going to maybe go on to develop a food allergy. That means 98% of the time, they're not going to have a food allergy. And I think, again, that's another way to just reframe this idea and recognize, okay, this could be an issue, but it's probably not going to be an issue. And the earlier I start within that recommended range, the less likely it's going to be an issue going forward. I think we talked about this issue in 2017 or so. That was after the LEAP study was published, right? The Learning Early About Peanut study that was published that showed that when peanut foods were introduced to high-risk infants starting at between 4 and 11 months of age and then kept in the diet over 5 years, they had somewhere around an 86% reduction in the risk of developing a peanut allergy.
That's huge. Yeah.
Since that study was published in 2015, there have been several other studies published too that have looked at low risk or no risk, and there's still benefit to early introduction. It still reduces the risk. Even if you don't have a baby that has high risk or that it's, significant risk, there's still a reduction when these foods are started early. So even for babies who don't have known risk factors, starting early can help reduce the risk of food allergy. And that's why this is in the dietary guidelines, because it benefits all babies.
Mm-hmm. What are the criteria for risk? What are the risk factors?
Sure. The identified risk factors for infants are severe eczema, or, severe to moderate eczema, but severe eczema puts a child into the high risk category. So severe eczema is eczema that's sort of prolonged and difficult to treat and doesn't respond well to like topical intervention. That's a child that's probably at highest risk for developing a food allergy. Having already diagnosed a specific allergy. So like in infants, it's usually egg allergy, pops up early. So if a baby's been diagnosed with egg allergy, they're at higher risk for peanut allergy. So combining those two together, egg allergy or having a previous allergy and severe eczema increases the risk again. So that's kind of the babies that are at the highest risk is babies with severe eczema or with existing egg allergy. It's good to talk to the pediatrician first, right? So talk to the pediatrician, see what they say. And these are the babies that probably starting even before 4 months is going to be of the most benefit because the longer a baby has eczema, the more likely they are to go on and to develop food allergies.
Oh, interesting. Now, what about a family history of allergies? Does that put a baby at more risk? And what about screening? Can you talk about screening for food allergies?
Yeah, these are great questions. So having a first-degree relative, that's what we kind of always typically said was a first-degree relative increases your risk. But when we look at the data, it actually is not a huge increase. Does it increase the risk? Yes, it probably increases the risk some, but it isn't significant like eczema or egg allergy or, sort of having already one allergy predisposes a child to developing other allergies. So that's more powerful or a heavier weight than having a first-degree relative with a food allergy. That doesn't mean there's no risk, but I would say that isn't a significant risk. It's something that certainly you can talk to the pediatrician about, but it isn't something that should cause fear. In fact, all of these things should really move a family toward early introduction because these are the babies that are going to benefit the most.
Okay, great.
So when we think about screening, I think one challenge we have is that we don't have good tools for screening as far as blood tests or skin tests. The tools that we have are really around identifying risk. They were never meant to be screening tools, and so they don't really function well in that capacity. And the reason is because they have high false positives. So what we know is that many people will develop antibodies to different things, right? So if you just screen lots of people using a blood test to see if they have IgE antibodies in their body to specific foods, you're going to find that a significant percentage of those people are going to have positives. But without having actual reactions, those positives don't mean anything. We can have positive antibodies, but if we have those without having symptoms, it's considered to be clinically irrelevant. It doesn't diagnose food allergy. The real thing that diagnoses food allergy is having a reaction. So interestingly, we have these sort of stratified risk categories, right? So like the high risk, as I've discussed, and then we've got some moderate risk or low risk. But what we see from the latest recommendations from the experts in America and in Canada that kind of got together and developed new guidelines or recommendations, they actually said we shouldn't be screening babies, we should just be feeding babies. Because the chances of a baby having a severe reaction in infancy is pretty small. It can happen. Anaphylaxis can happen in infancy, but it's uncommon, especially compared to waiting until later in a child's life. So if they are going to develop a food allergy or they have already developed a food allergy, if they have it in that first year, it's not going to be a severe reaction as it would be if they find out later on because of either accidental ingestion or purposeful ingestion after 1 year.
Interesting. Okay. So the research is very clear about introducing potentially allergenic foods to babies within that around 6 months. And you mentioned earlier if the child is at high risk, maybe even before 4 months.
Not before 4 months, before 6 months.
Okay.
So yeah, so most babies can start around 6 months. That's really the general recommendation is when you start complementary foods. My suggestion to parents is, start feeding your baby the foods that you want to feed them, in the style that works for your family. Some people are going to do baby-led weaning. Some people are going to do a more traditional puree, whatever works for your family. I'm seeing a lot of people actually do a hybrid, which is great. And then once you've fed them several foods and they don't show that they're having a problem eating, right? They're ready. They're developmentally ready. They're taking to the food and they're not having any sort of reaction. You're not seeing any sort of reactions. Then start the allergens. And the research is most supportive around peanut and egg. So I always suggest get those foods in early and then think about the other allergens over the next few months, right? Get them all in the first year, but don't stress about getting them all in at 6 months with the exception of egg and peanut. I think those start early and then keep them in the diet as you start to add other foods.
Yeah, you've mentioned that a couple of times. What is the research showing about the role of keeping that food in the diet as you move forward?
It's interesting because we don't have a whole lot of information on longitudinal outcomes, right? So following for many years, except the LEAP study, which I mentioned already, sort of that early study, the big study that showed peanut introduction can help prevent. What they found was that they followed those infants those children. They were infants when they began and they followed them all the way to 5 years old. What they found is that those children, when they stopped eating peanut, they actually did a follow-up study and had them stop eating peanut for a year. And then they reintroduced peanut to see if they had truly prevented the allergy or if they just delayed it. Because there's some thought that maybe it was sort of like an oral immunotherapy. And the longer, as long as they ate it, then they stayed non-allergic. But if they stopped eating it, they would develop an allergy. Well, they actually found that they didn't develop an allergy. Even if they stopped eating it after a year, they still didn't develop a peanut allergy. So we don't know what happens if you stop eating after a year or you stop eating it after a few months. We don't know that. But we do know that in some cases where children have had food allergies, like diagnosed food allergies, and then they go through a treatment protocol like oral immunotherapy where they eat small amounts of the food in increasing doses over many months to sort of increase their threshold. If they stop taking their immunotherapy, if they stop eating the food, then they sort of relapse back into their allergy. So the thinking is that, in case there is this potential in infancy that desensitization or tolerance might be lost, we want to just make sure that we're keeping that food in the diet so that that doesn't happen. I don't think that we have the research now that shows that, if you stop after 1 year, you're, never going to develop an allergy, or if you stop after 2 years, we don't have that. But we do know that the LEAP study showed that when the food was kept in the diet for that 5 years, they didn't go on to develop a food allergy.
Okay. Thank you. You mentioned baby-led weaning, and, that seems really popular these days. Does that or how does that fit in with the recommendations for introducing these allergens?
Well, I'm no baby-led weaning expert. I will preface that. But I am a fan of it. And I like it in conjunction with purees because I think you can do both. I think it's good for babies to learn to use a spoon just as it is to learn to feed themselves, right? So the idea behind baby-led weaning is really letting the child take the reins on eating food. And it's consistent with a lot of other recommendations or guidelines that dietitians think of when it comes to food anyway, right? Recognizing your own hunger cues, recognizing your own satiety cues. Knowing what you like and don't like. And it gives the baby the chance to control how much they eat, but also whether or not they eat the food. And it lets them use all of their senses, right? Squishing the food in their hand and holding it in their hand and, helps them learn to feed themselves. So I like all of that about baby-led weaning. And in general, you use foods that are appropriate to the child's developmental stage, right? So some of it's very softly cooked foods that they can pick up with a palmer grass or a pincher grass, depending on where they are. In some cases, it's using foods that they're not really going to chew and swallow, but that they're going to suck on, like a piece of meat, that sounds scary. But in the way that they do it, it's such a large piece of meat that a child couldn't choke on it, but it gives them something to chew on and suck. And it works well, I think, for many foods. And for the allergens, you just have to consider how you need to modify it to fit into this. So a good example would be with peanut butter. If you're using a puree, it's very easy, right? You can just add a little bit of warm water, breast milk or formula to peanut butter, and then make it into a consistency that's appropriate for your baby and feed them with a spoon. Or if you're using baby-led weaning and you've already introduced toast, you might take, a small piece of toast that typically they recommend that it's about the width of 2 fingers and about the same length. And then it's toasted lightly so that it doesn't turn into a gummy ball. And you could spread a very thin layer of peanut butter on that, and then that would be fine for a baby too. You could also use something like the puffs. There are a number of products that are out there now. One of the exciting things I think that's come out of this whole early intro of allergens is seeing just a lot of new, exciting, and interesting products for infants and young toddlers.
Interesting. Thank you for those specific examples. I was going to ask if you can share some practical tips like that, especially regarding peanut foods in particular. And also kind of just give us some specific takeaways or tips for early introduction of peanuts and what parents need to know. How do they go about doing this?
Well, the first thing I would say is to start early in the day. You want to do it before the baby takes a nap so that you can observe them. And you want to start with a baby that's healthy. I think that's one of the best recommendations for introducing any new food, but definitely a potential allergen. You want to start with a baby that doesn't have a cold, because sometimes if they start to get fussy or whiny, or even if they throw up, you might think that it's a food allergy reaction and it could just be a virus. So start with a healthy baby, start early in the day, well before a nap, and then mix up a whole portion of the food that you're going to feed them. So one of my favorite ways to do it is using infant cereal. So you can make a portion of infant cereal and then put in a couple of teaspoons of peanut butter, mix that in, and then the baby gets to eat peanut butter oats, which is one of my favorite breakfasts. And then you start with just a tiny amount on the tip of a spoon and give it to the baby, and then wait about 10 minutes or so and see if the baby has any sort of reaction. Chances are, as we've mentioned, they're not going to. And then you just move forward with the rest of the serving and feed the baby until they're finished eating. And then you want to watch the baby for a couple of hours, just making sure that there are no delayed sort of reaction, that you don't see something coming up. And the most common food allergy reactions in infancy are rash, so having hives that are sort of, all over their body, or even just around their face. That might be one sign. And then vomiting is another. Those are the 2 most common reactions to food allergies in infancy.
Okay, good to know. I understand that there's a new certification program through the National Peanut Board.
Yeah, so we have a new program called Certified Peanut Pro, and it is where dietitians can take these brand new learning modules that have been approved for continuing education credit, and you can learn all about peanuts. And there are lots of different topics, from everything from sustainability to health and nutrition to food allergy. And these Peanut Pro modules are led by a bunch of different experts in their topic area. And when dietitians complete it, when they've completed all of the modules, then they are a certified Peanut Pro.
Excellent. And we'll have links to that in the show notes, of course, as well. And, I do think it's really important for dietitians and other healthcare providers to help support parents through this stage of life. There's a lot going on, at that time. So I'm really appreciative of this information and really want to give you an opportunity to really make it clear to our listeners, really how important this is, that it can really make a big difference.
Yeah, what I would say is that people really need to understand that the research supports and the experts agree that we can significantly reduce the risk of babies going on to develop a peanut allergy just by simply feeding them peanut foods in an infant-safe way early, starting at around the same time that other solid foods are introduced.
Mm-hmm. Excellent. Thank you. And where can people find you and the National Peanut Board online? I'll have the links in my show notes, but if you'd like to share the website and maybe some of the social media handles.
Oh, absolutely. We are everywhere. So you can find the National Peanut Board at their website, nationalpeanutboard.org. And we actually have a dedicated site for preventing food allergies at preventpeanutallergies.org. And that site has great information for parents who want to learn more, and it even has a section for health professionals. And of course, you can find the National Peanut Board on Facebook and Pinterest. Facebook is at National Peanut Board and Pinterest is at Peanut Farmers. And you can find me on Twitter and Instagram at PeanutRD.
Excellent. I'm also going to have links to other resources that you shared with me. Like you had mentioned several times about this LEAP allergies study. That's not to be confused with LEAP therapy. That it's Learning Early About Peanut Allergies study. And that's in the New England Journal of Medicine. And there's a ton of great resources on the Peanut Board website. So I really do encourage people to go there. So Sherry, is there anything else that you wanted to share with our listeners as we wrap up?
Well, I think that you hit all of the main points, and I really appreciate the opportunity to share this information and look forward to hearing if your listeners have any questions. They are certainly welcome to reach out to us.
Excellent. Wonderful. Well, thank you again for coming back on the show. It had been a while. You're always a great guest. You can come back on anytime. Thank you for this interesting and important information. And for everybody listening, as always, enjoy your food with health in mind. Till next time.
For more information, visit soundbitesrd.com. Music by Dave Burke, produced by Jag in Detroit Podcasts.